millions nationwide. But for kids with Down syndrome, it's more than just a nightly nuisance. KCAL's Cara Finstrom highlights a groundbreaking treatment helping young children get the rest they need.
Children who have Down syndrome often struggle with sleep apnea. Here in Long Beach, we caught up with one of the first young patients to get a new type of treatment for it. Alden Fletcher has always been active, playing water polo, working as a junior lifeguard, and surfing. But he used to also nod off in the middle of the day, exhausted. His mom says he'd be snoring loudly, and what really worried her...
stopping breathing or having your sleep interrupted at night. It's kind of scary.
Marlena brought Alden in for sleep studies, and last year they discovered he had severe obstructive sleep apnea.
It affects your heart and your immune system.
The incidence of obstructive apnea in Down's syndrome children is about 60 to 70%.
That's compared to up to 6% of children who do not have Down syndrome. Doctors Gary Feldman and Namrata Varma work together at Miller Children's and Women's Hospital in Long Beach. Varma says children with Down syndrome have physical differences that make them more vulnerable.
Their tongue falls backwards into their throat and blocks their airway.
The first standard of treatment for most severe cases like Alden's, the CPAP machine. It blows air into the throat to keep the airway open. But many children, especially those with Down syndrome, won't keep it on their faces.
We had to tell him he was Maverick from Top Gun. And he would wear it. 1 or 2 hours into the night, he would just take it off.
Even if you take regular adults, only 50% of them can actually tolerate the CPAP. We said, well, what else can we do for him?
Alden's doctors turned to an alternate treatment, Inspire therapy. It involves implanting a device under the skin near the collarbone that sends gentle pulses to a nerve.
The nerve that controls the movement of the tongue and allows it to gently pull forward during sleep and open up the airway.
The FDA-approved use of the technology in adults with certain types of sleep apnea back in 2014, but patients have to try using a CPAP machine first. Last year, the FDA extended its approval to children like Alden, and Miller Children's and Women's Hospital in Long Beach has now treated 8 young patients.
So far, the children that we have implanted and the adults that we've implanted have all done very well.
Alden turns on his device with a remote before going to sleep. The hospital says an initial study during his activation suggests his episodes dropped by more than 70%.
He's not snoring. He is waking up with energy. He's happy.
We've been waiting for something like this for our patients with Down syndrome.
These doctors will continue tracking Alden. They say all children with Down syndrome and adults experiencing moderate to severe sleep apnea should talk with their doctors about the different treatments now available.
Do you sleep better than before?
Yeah.
Alden's mom says his treatment has her resting better at night, too. Cara Finstrom, KCAL News.